Hey, so folks, today we're going to talk about really the definition of functional medicine, functional nutrition, and functional endocrinology. These are terms that you're going to hear more and more about today in healthcare. And really, I think a lot of the people that are coming to us want to have a clear understanding of what do we mean by functional nutrition, functional endocrinology, and functional medicine. So here with Dr. Melissa again today, and we're just going to have a discussion, kind of go over this. So really, for those watching, what is functional medicine, functional endocrinology, and these terms functional? What does that mean?
Great question. The simple answer is we're looking at how your body and your health and your specific systems are functioning. In the traditional medical paradigm, we're focused on, traditional medicine is focused on symptomatology and dis-ease, so making a diagnosis. So you're labeled as hypothyroid, you're labeled as a diabetic, you're labeled as that you've got fibromyalgia, so you have a label. And it's just really treating or managing really the state of that label is what the whole traditional paradigm is about. In the functional world, what we do is, while yes, it's important, we want to know your label, the label does nothing for us. Knowing a title, a diagnosis, doesn't tell us the root cause, the underlying etiology of what actually created that diagnosis to begin with.
So in terms of functional medicine, we're more interested in the way all the systems interplay.
Absolutely.
And what was, as we talked about, the underlying cause, because most of the time, and I know you know this, is there's multiple problems going on at one time. It's a cascading and several different things coming in and coming out that need to be managed. It's not just one thing. Meaning, if you have diabetes, is it just a blood sugar dysregulation, or are there more factors involved?
Many more.
Yeah, if you have a thyroid problem, is it just the thyroid that we should be paying attention to, which is often in traditional methods,
right.
That's all they're paying attention to. And in functional medicine, and what we do are functional endocrinology and functional nutrition, how we treat, we are looking from a global standpoint and looking at how every one of these systems plays a role. So for the folks that are watching, why don't other doctors do this?
Well, they really can't. I'm sure that there's a wide amount that would really like to, but the way that the medical paradigm is set up is it's very process oriented, and there's a protocol. So if you have a certain lab marker, then there is a certain drug that's prescribed. That's protocol. And the protocol is, if that medication doesn't work, here's the next medication. And so there's so many people, it's a numbers game, folks, because really what's happening out there is we do have a healthcare crisis. More and more people are getting sicker by the day, for many other reasons that we'll discuss on other videos, I'm sure. But, and there's just not enough healthcare professionals to properly treat and manage. So that's why you get so little time with your doctor. It's just bring them in, bring them out, find the diagnosis, give them a pill, on to the next. And they don't have the time to be able to look, because really what we do, not only in this office but in functional medicine, is we do take that global, that whole person approach, because what we all know, any doctor of any type, is that the main driving factor of the body is to maintain homeostasis.
Balance.
Which is balance, absolutely. Right. And when there is imbalance, then there is dis-ease, disharmony in proper functionality. What could have started as a plain blood sugar issue, as soon as that is dysregulated, it's not just a singular mechanism. And again, traditional medicine is very mechanistic, but the human body is not mechanistic.
Right.
Everything is interrelated, everything is interconnected, and really works synergistically and dependent upon one another.
So what's interesting that we find is when folks come in here and they get started and enrolled in our program, they often say to us, well, I've never had a team of doctors, and really just a team, all our office team, spend more time getting very detailed about the specifics, because they have found that in their traditional office setting that they've gone to and the system that they've been in that they want to get away from, the doctor spends what, 5 minutes maybe? Maybe even doesn't review the results. And oftentimes, again, in functional medicine, I I thought this was very interesting because people just don't necessarily understand is, are we looking at the exact same lab values that the other doctors are looking at and making a clinical decision, or are we playing off of a different range? And what is that range?
Again, excellent question, and something that we get often from our patients that, again, traditional, they're looking at the very high or the very low end of a clinical range. And what that clinical range is basically a bell curve. It's a numbers game of the number of people that come in that are essentially sick, that we already know they have some relevance or likelihood to have this number. So that's the average of it, and it's over the bell curve. And your doctor is looking when you're out of that range. So you're high, you're low, you're out of it, then there's some action that's going to be taken, a medication is going to be prescribed. By that point, you're already in trouble. You're already there, you've done. If the numbers are hedging up, the doctor typically says, let's keep an eye on it. Let's wait and see. Well, they can't do anything until it hits that certain number because, again, it's protocol system. When A plus B occurs, that is what's going to equal C, the writing of the prescription. And there's nothing really that they are able to do in the let's wait and see. So what we look at is we still do the same clinical diagnostic testing, but we want to take a proactive and preventative measure. Now, many of our patients come in where they're already in the danger zone. They're already in crisis, they're already in that chronic state, so we want to help bring them back. But we take a very comprehensive look at not just a thyroid panel, for example, or a metabolic panel, for example, for looking at diabetes and maybe an A1C. We look at the main systems of the body. Mm-hmm. We see where things fall within that high to low. And we like to look at what's called functional or healthy or optimal, which is in the sweet spot, right in the center of that bell curve, so to speak. That's ideal. If we are out of ideal, we go early warning sign, then we go warning, red, and then we go to kind of code blue when they're very far outside of it. But we like to look, if you're outside of that optimal range and we can catch it early enough, those are vital pieces to the puzzle. And I can't tell you how many times I sit with patients that their conditions are missed because they haven't fully gotten out of range yet. Okay. But each system is so sensitive and so different. So what's normal for you is not the same thing that's normal for me.
Yeah. How about this? I found this interesting. Again, the comparing traditional methods of taking care of these problems and functional medicine is if there is a lab value that is high or low, mm-hmm. the traditional approach is to throw a drug on it or do something. But oftentimes, and I know you found this, I know I found this with our patients, is that could have been out of range because there's another system that's being affected. So actually just trying to treat that lab value with anything, whether it was a drug or a nutraceutical, is probably not the best idea until you've actually gone through a systematic approach of trying to understand why that may be out of range. Because a lot of times, I know this, we're not doing anything for a few different lab ranges that are out of balance because we're waiting for the body to start to heal itself and they then naturally come back into.
So a perfect example is with thyroid. Thyroid patients typically in the traditional medical paradigm have been assessed by their endocrinologist looking typically at the TSH, maybe T3, maybe T4. In our office, we do an expansive panel. And as we go through, many thyroid patients actually have a liver problem and don't even know it. Now, why does this matter? Well, about 60% of the thyroid hormone is converted from T4 to the usable form of T3 in the liver. Yeah. And so if there is an underlying problem in the liver and that's been missed, how do we really know if the thyroid is the organ, the gland that's truly dysfunctioning? Right. What else is going on? What's at play? So like I said earlier, Michael, we're really looking at the root causes, the underlying condition. You're more than just a diagnosis. We want to understand what systems have been impacted, what has become out of balance. Remember, we're trying to achieve homeostasis, that active balance, and we're going to put the pieces back together of your health step by step to really make that whole comprehensive, optimized health at the end of the day.
Well, so that's great, and I think that everybody watching this now has a really good, clear understanding that functional medicine, functional endocrinology, and functional nutrition, what we do here in the office, is really looking at the whole person, not just looking at one organ or one hormone, but putting a whole picture together and how they all interplay and interrelate to one another. We look at the GI system, the liver. We got to clean, as we say, clean the house, get everything detoxified and literally healthy to start this process, which is often overlooked by everybody else out there. And really, it's coming together and focusing on what are the main causes that created disruption in someone's health so they actually got labeled with a diagnosis. But really, at this point when they come and see us, it's not about that. It's about getting them whole. It's about getting them well. And really, for most people, it's trying to get them off of all these complicated drugs that they're on. And really, when their body gets well, they don't need them.
That's right.
So thank you so much. I appreciate it. I hope the folks watching that have a better understanding of what functional medicine is. And again, if you have any other further questions, just reach out to our office and schedule time to come in, and we'll be happy to take a look at you and see if we can get you back to optimal health.